Vaccination saves lives. Imagine a situation when you, as a parent, have to decide whether to vaccinate your child or not. You may have heard in the news of some incidents where vaccination caused some effects. But I bet you're also aware of the countless benefits of vaccinating children. You will be forced to weigh between the merits and demerits of vaccination before administering it to your child. In some cases, parents are influenced by the internet exposure to decline vaccination, while some acknowledge the adverse effects are rare. In reality, the purpose of vaccines is to boost human immunity by fighting against diseases and eradicating them. Many people believe vaccinations are a matter of public safety. Therefore, vaccinations should be administered to all children before allowing them to enroll in school where other children are present. Although people on both sides of the issues have valid perspectives, there is a strong evidence to support the position that children need to be vaccinated because vaccination saves lives, prevent diseases from spreading, and protect future generations. The first reason why children need to be vaccinated is to reduce fatalities associated with diseases. In the 1800s and 1900s, millions of people, especially children, have died from diseases such as smallpox, measles, mumps, and rubella. I have a chart here. The reduction of cases and deaths of vaccine-preventable diseases in the United States after the introduction of the vaccine. As you can see, the cases and the deaths, almost all, have been reduced at 100%. Some programs, such as Vaccines for Children program, has helped vaccinate children from families that cannot afford them. VC program, among other government-funded programs, has increased the vaccination rate. Vaccinations should be administered to people containing the spread of diseases to the unimmunized population. Some people may not be vaccinated for various reasons, including some medical conditions. The risk of infecting adults is minimized when the children are vaccinated and everyone's health is maintained. Dr. Ali's study demonstrates the importance of vaccination carried out in Bangladesh on the foundation of killed oral cholera vaccines. According to Dr. Ali, the use of oral vaccines proved to protect the recipient and unvaccinated from cholera. No one should opt out of vaccination because vaccinations are safe, effective, and covered at 100% expense by insurance companies. Vaccines are highly regulated and have been since the establishment of the United States Vaccine Agency in 1813. Health insurance companies are required to cover the cost of preventive care at no charge to families under the Affordable Care Act. Vaccinating everyone would now save future generations from the risk of diseases experienced in the current world. This statement can be supported by recalling and analyzing smallpox, which used to be termed the deadliest disease and the leading killer of children. In 1980, the World Health Organization officially declared smallpox is eliminated worldwide through vaccines' help. With the elimination of the disease, the use of its vaccine was no longer valid. Other diseases, including measles and polio, are yet to be eliminated across the Western countries because they have not eliminated them already. The efforts of the 1996 strategy plan, organized by the Pan America Health Organization, saw the 2016 official declarations of eliminations of measles in the United States of America. As demonstrated by these statistics, it is justified to say that the control and eradication of diseases can be attained from the utilization of vaccines. Therefore, ensuring that people are vaccinated will eradicate the present diseases and save the lives of future generations. In conclusion, since the adoption of vaccines, the debates have intensified and peaked during the 1998 autism scare. The vaccination practice is over 200 years old, which might be why people tend to forget the importance of vaccinations as it was perceived earlier. The existence of federal mandates that require students to receive vaccinations before enrolling in school is an extremely controversial one. In today's society, many illnesses that were once prevalent, such as smallpox, measles, and polio, have been virtually eradicated. People do not realize how fast these illnesses can spread and harm a population. Many parents believe that vaccinations are linked to development delays and the development of autism in children because anti-vaccination groups have manipulated them. Declining immunization is accompanied by dire consequences such as the occurrence of epidemics, disease outbreaks, and pandemics. Anti-vaccination groups should bear in mind that their manipulations affect a few individuals and everyone around them. The immunity of the entire population is achieved when diseases are eliminated. Besides, it is crucial to acknowledge the research finding that vaccination saves lives, prevents the spread of diseases, and eliminates fatal diseases, thus saving our future generation. The role is taken by the government-funded organization and vaccine research illustrates the significance of administering and facilitating vaccination. When choosing whether to immunize your child, ask yourself whether your choice will promote well-being, safety, and joy for the overall population. Thank you for your time.